Good morning, everybody. My name is Irene Amron from the Red Cross Red Crescent Climate Center. I'm here this morning to share with you one of our good practices that we've been implementing within the Red Cross movement in partnership with our partners towards bridging the gap against climate shocks. This practice is called focus-based financing. Advances in science can now help us to better predict climate hazards. For example, a research by the Focus-Based Preparedness Action Project in Kenya shows that reliable or skillful seasonal forecast for October to December rains over the IGAD region can be available as early as June, as you can see on the map on my left-hand side. And the seasonal forecast is even more reliable for extremely wet years, as you can see on the right-hand side. This is due to now the well understood relationship of the sea surface temperatures as a key driver of seasonal rainfall in the region, especially during the El Nino and the La Nina events. Scientific advances mean that climate-related hazards such as drought and potential for floods within a season can now be better forecasted. This allows for anticipatory actions to be implemented in the window between a forecast and a disaster. The question is, can we set up an automatic system that triggers and funds preparedness actions before a disaster strikes when a credible warning arrives? If so, we can prevent suffering using humanitarian funds more efficiently and contribute to strengthening community preparedness and resilience. And that is where focus-based financing comes in. So what do we mean by focus-based financing? This is an anticipatory mechanism to trigger funding before a disaster to implement early action based on a credible forecast and an in-depth risk analysis. The aim of focus-based financing, it is to anticipate disasters and reduce humanitarian suffering and losses. And the picture you see there on the right is of Uganda Red Cross when they did activate focus-based financing in Eastern Uganda in 2013, and they were able to support communities in advance of a pending flood. So what do we look at when we are talking about focus-based financing? There are three main components. That is the triggers. Triggers literally meaning issuing an alert of a pending a flood or a drought or any climate-related hazards. And then matching forecast together with the risks, including an analysis of exposure, impact, and vulnerability. Then the second one is a selection of early actions, which early actions can be implemented in advance to reduce the anticipated humanitarian impact. And then, of course, all this is enabled with ring-fenced financing. So there has to be a mechanism that automatically allocates or releases funding before the disaster strikes to be able to implement these early actions based on the selected triggers. And all this is written within the framework of an early actions protocol that clearly provides roles and responsibilities on who takes what action where once a threshold or a trigger has been reached. And for the Red Cross to be able to do this, we have been implementing a focus-based financing in Uganda, Kenya, Ethiopia, Zambia, Mali, and currently starting on developing a focus-based financing system for drought in Southern Africa. And we are using a methodology recommended by the World Meteorological Organization, that is the impact-based forecasting methodology. So literally, with the impact-based forecasting methodology, this helps to translate meteorological and hydrological hazards into potential sector-specific and context-specific impacts. For example, in Kenya, the impact-based guidelines implies combining a seasonal focus from the meteorological department with the food security assessment from the National Drought Management Authority to anticipate potential impacts of the forecasted rainfall. This would result into a map, as you can see, the one developed below. For Kenya, this process is still ongoing. We are to develop a map such as this, but the map that you see here is an example that was drawn from Peru that can provide information such as where action can be taken based on the forecast and who will be most impacted. So in summary, the impact-based forecast will help let us know where do we act, who will be the most affected and what actions can be taken. And this process has just been completed in Uganda. So we do have an intervention map where areas that are at high risk of flooding have been mapped, and in that area so far 26 districts have been identified, and then of course who will be most impacted with the anticipated flood. And children below 5 have been identified, and these ones will be mainly susceptible to waterborne diseases, women, then the poor, and then also, of course, we took a look at refugees as well as one of the people who will be most at risk. And in terms of infrastructure, shelter, especially those that are constructed with weak materials, have been identified to be susceptible to flooding in the event that it happens. And then early actions have also been identified, and these include evacuation once the forecast has been received, provision of cash to enable people to be able to move, as well as provide for themselves basic needs in the areas that they have moved towards. And then another early action is the distribution of water purification tablets to ensure that people have access to water even when flooding happens. So what you see here is a demonstration of the steps that we undertake in terms of developing this impact-based forecasting methodology. So of course, the first step is the risk analysis. Basically, with the risk analysis is just to let you know of what hazard affects the people. Is it the drought? Is it floods? Is it a cyclone? Is it a typhoon? And for Uganda, Kenya, and Ethiopia, they did identify that it is floods and drought, and therefore they'll be working at addressing the impacts of these two hazards. And under the risk analysis, based on historical data, we look at what have been the impacts of this hazards. So for Uganda, the impact based on the historical analysis has been that, of course, people have died, houses are destroyed, and people are displaced. And those are part of the risks that they would like to address. Further analysis looks at who is most at risk and where are they located. So basically looking at the vulnerability and exposure analysis of the people who are at risk, of the assets who are at risk. And then the next step, of course, is looking at inventory. When we're talking about focus-based financing, of course, the focus is one of the critical factors. So within the inventory of focus, we look at what focus are currently available in country and regionally that can be used to trigger early actions. In again, the 3 countries, Uganda, Kenya, Ethiopia, analysis have been done of the existing forecast, and so far it indicates that all these countries do not have national flood models. Some countries are in the process of developing them. So in the interim, we will be using the global floods awareness systems to be able to activate early actions. And then, of course, the third step is defining the magnitude, defining the hazard magnitude. At what point does a certain level of water become a problem? So, for example, we looked at an analysis we looked at the analysis in terms of what GLOFAS has been predicting before, and correlating that amount of water to the damage that has been identified, and of course also looking at the return periods. And for this, we are working within the return periods of we are working within a 5-year return period. Then the fourth step is defining or developing an impact-based forecast, and this we've used a combination of expert knowledge and then also modeling. And then this we should be able to be able to develop an impact-based forecast. And then finally, with the impact-based forecast, we overlay this with the vulnerability and exposure, the results from step 1, to be able to get for us an intervention map. So for Uganda, this process has been completed. For Mali, this process has been completed, and now we're just waiting to activate in the event that the forecast indicates our thresholds will most likely be reached, and so early actions will be undertaken. So the implementation process follows a 9-step, and important to know that this is not a linear step. As I mentioned earlier, of course, the risk assessment, it's just to understand who is at risk, conducting a vulnerability and exposure analysis, then looking at the forecast in country and at regionally, then globally if there is nothing that is available. Then also an understanding at what point does a particular hazard become a problem. So all these processes, at least for Uganda, have been completed in terms of defining, developing an FBF system for floods. Mali has also completed, and we do have the early actions protocol that has been approved. So that means that these countries will have access to anticipatory funding in the event that their thresholds have been reached. So this process is a very multi-stakeholder engagement process, because it needs a various levels of skill set. And for all the countries that I've mentioned, there's been good collaboration between the humanitarian organizations, between the academia, between the national hydrometeorological agencies, as well as in some cases, as well as the private sector that has been engaged. Because at the end of it all, we need to define which are the sectors that are most impacted, who is at most at risk of all these processes, and then what early actions can be developed. Then, of course, once the early actions has been approved, as is the case of Mali, then the National Met has now to continuously monitor, in collaboration with the technical working groups that have been set up, to ensure that in case the trigger is reached, that is part 8, then early actions is taken on time. This process has been very consultative from the national up to the community level. So at community level, the conversations are mainly around what risks are prevalent in this community, who is at most at risk, what early actions have been implemented before, or why are you not taking early actions, where are the gaps, and how can this be addressed. And then, of course, early actions are jointly agreed upon together with communities, and then the Red Cross will provide the funding that will be needed in case the trigger is reached. What are the lessons that we've learned? One, we've realized that the development of FBF requires a multi-stakeholder engagement facet approach that includes national hydrometeorological services, the DRR practitioners, the academia, among others. And then, of course, the system should also be set up to activate early actions anywhere in the country. We do not recommend predefining geographical areas at the very beginning. The main reason being that the forecast can indicate anywhere, and yet you may concentrate in only preparing one community. And we had this experience in Teso, where we had prepared one community, and then yes, flooding occurred in that community, but then also flooding occurred with more extreme impacts than the community that we were supporting happened in another area. And therefore, because we had already defined this, and sometimes with donor restrictions, you spend money in a geographical area that you've said you will spend it. So based on that lesson, we have recommended that we will use a national scope approach, meaning that we will activate early action where there is a likelihood of the anticipated impact happening. And then, of course, all this in terms of the risk analysis, understanding forecast is very critical, and the robustness of the system depends on the quality of the data available, especially on vulnerability and exposure. We've had a very big challenge in terms of access to quality data, but then we decided that we will work with the current limitations of data as we keep improving the system. So data is very critical in all these processes, access to it, and then also the quality of the data. It kind of helps to inform how robust the system is. So briefly, that is what our approach is all about. And it is being implemented in various countries over Africa. Unfortunately, I don't know why the map is not reflecting there, but focus-based financing is being implemented in West Africa, is being implemented in East Africa and Southern Africa. And globally, this is being implemented in over 60 countries with other partners such as the World Food Organization, the START Network, FAO, and within those 60 countries, the Red Cross is active in 30 countries. Thank you so much, and happy to receive any questions.